How do I decide if I want an epidural or if I should go without pain medication during labor? This is completely a choice for you to make. Um, there are some benefits to having an epidural. There are also some risks to having an epidural, and it certainly changes the kind of labor that you can have. If you're at like 6 or 7 centimeters, and you're dilated to 6 or 7 centimeters, and that pain is manageable, and you feel like, you know what, I can do this, it might be worth it to proceed without receiving an epidural. That pain, when you get more into like the true active stages of labor, is going to be about as bad as the pain will get. If you are at a 6 or 7 and you are like, I can't do this, and it's really truly difficult for you to deal with the pain, then absolutely proceed with an epidural. Doulas are there to support you in your choices and what your goals are for your birth. So if you decide to go to the hospital and that you want all of the interventions that the hospital can offer you, if you want continuous monitoring, if you want an IV fluids, if you want all of the pain medications, that's fine and normal, and I can still be there to advocate for you for those wants. However, if you decide you really want to try to go for a more natural labor and that you want to have an unmedicated birth, then there are lots of things that we can do to provide comfort measures that can help prevent an epidural. If you have an epidural, it can limit the positions that you labor in. It is more likely that your provider is going to ask you to labor in bed. So that means that we can't walk around during labor, that we can't dance or sway during labor. There are lots of positions we can still do in the bed to help alleviate some of that pain. Or not so much of the pain, because you really shouldn't be experiencing pain, but to help alleviate some of the pressure.